Hello, everybody. Welcome back. Today, we're going to have another installment of If Bones Could Talk, which is a podcast by us here at Palmetto Bone and Joint. Again, I'm Dr. James Logging, and as always, with me is Dr. Jackie Van Dam.
Good to see you tonight. We're excited about a new topic
Yeah.
to discuss with you this evening.
Yeah, absolutely. So, we tried to think about what would be an interesting topic that would affect a lot of different people. And so, obviously, foot pain is a big problem that a lot of people have. Dr. Van Dam, as well as myself, and a lot of the doctors here. I mean, that's a pretty common complaint, I would say. And so, we're going to kind of talk about what are some of the most common things we see with regard to foot pain. Kind of the certain treatment recommendations. And, by no means are all of these things, the only things you can see, because there's a lot of different options out there or problems out there that, you may have. So if we don't cover exactly what your specific problem is, you're welcome to write in on Facebook, and we can answer your questions tonight, or, schedule an appointment with us and come in and let us take a look at it and see what the problem may be and what we can do to help. So first up, I think we're going to talk about one of the most common things, I think you would agree, Jackie, that we see is plantar fasciitis. And, this image here, which we kind of show everybody, the plantar fascia is basically a big ligament that runs on the bottom of the foot, and it's really broad out at the toes. And as it attaches on the heel, it becomes really narrowed and concentrated. And because all of that force is concentrated in that one area on the insertion of the calcaneus, that plantar fascia can become extremely inflamed and painful. And so that is a pretty common problem I think we see. So what do you typically do for plantar fasciitis when you see somebody, Jackie?
Yeah, I think with the plantar fasciitis, it is sort of a common complaint that often you might present and tell us that the first thing in the morning when you put your foot down, it's the worst part of your day because that heel feels like it's being shot into. And then as you walk, the pain might go a little better. When you're sitting down at work, it all of a sudden gets a little more painful when you stand up again. And the first things we think about are evaluating your range of motion around the ankle. And oftentimes people are tight around that heel cord up in the Achilles and the plantar fascia. So, first thing, I'll teach you some stretches in the office to stretch that gastrog muscle and the soleus and try to loosen that up. Sometimes it's easier when we give you a splint at night, and so that while you're sleeping, that connective tissue doesn't shorten back down. And that can be probably one of the most helpful things. I also always tell people to get a water bottle and put it in the freezer and kind of massage over that plantar fascia. So it's sort of like a massage and ice in one.
Yeah, that's a great suggestion. Research has showed that, 80% of people who have plantar fasciitis, stretching alone can get it to resolve. And so, we can't really stress the importance of the stretching. So the stretching exercises that we can teach you are one thing. The water bottle is an absolute great idea because it does the stretching as you roll it across the bottom of your foot, but also it ices it at the same time. So it's kind of that best of both worlds. So that is an excellent suggestion for it.
And then I guess occasionally we do need to inject the plantar fascia with some steroid, especially in patients that just aren't getting better. Because this is one of those kind of tendinoses that it's like a tendinitis that can get chronic, wouldn't you say? It's one of those that can possibly have that happen. And so an injection often helps as well.
Yeah. And a lot of times, by the time people make it to us, I mean, they've been dealing with it for a while. And, maybe you've already tried some stretching and anti-inflammatories and things like that. So, yeah, the injection definitely is an option that's a pretty quick resolution to it. The question is going to be, is it going to resolve it? And a lot of times it can clear it up and get it to go away. And then other times it may not, and then obviously if this becomes a really chronic problem, you've been stretching, you're doing the bracing, orthotics or injections, and it's just not going away. Surgery is an option for that. And a lot of times people on x-ray, they will have a heel spur that's associated with it. And so it may be something we have to release the plantar fascia and take that heel spur out. And that can make a difference too. But we try to, in this problem, try everything we can short of surgery. And a lot of times you can get it better without having to have surgery for it. So. So that is probably one of the most common things that we do and see with regard to foot pain. So I think another one a lot of people will have will be what's called hallux valgus or bunions. So a bunion, a lot of people think, as you can see in the picture, especially the picture that's there on the right, that big knot that's on the inside part of the foot. And so people think that a bunion is just that knot, but it's really a much more complex problem than that. And it's actually the alignment of the bones in the foot and how that joint on that first big toe is actually starting to slip out of joint. And so if you were to surgically correct it and just go in and cut the bump off, it wouldn't work. I mean, the toe is going to continue to get worse and progress over time. And so you actually, surgery-wise, you have to correct the alignment of the toe bones in order to resolve that problem. But there's still a lot of things you can do short of surgery. Obviously, surgery is the ultimate correction for it, but there are other things that you can consider doing with regard to braces in the shoe, or other things that would help resolve some of that. So one thing that Dr. Van Dam does, which is, we're pretty excited that she's able to offer this for patients, and it's a good solution, is orthotic fabrication utilizing FootMax technology. And I'll let her describe a little bit about that, because this is a great option for bunions, but also plantar fascia, and pretty much any of these conditions we'll discuss. But this is something unique that Dr. Van Dam does. So I'll let her kind of talk about it and what she offers with that.
So this FootMax system you can see up on the screen, this is called our Metascan system. And the goal with this is to achieve really kind of a subtalar neutral joint about that ankle, so that we're trying to make the alignment of the foot and ankle as close to neutral as we can. If you can see in the picture, this system will have you walk across this computerized force plate. So you're actually putting your foot over and over in this circle, and it's making sort of like a topographical map of your foot. So that way we can kind of see where are the abnormal forces, what's creating this abnormality, and hope to correct some of that. The nice thing about FootMax is that we, can treat so many different conditions with it. And sometimes I'll tell people, if we don't get it 100% for so many different problems, sometimes we'll do one orthotic, and then a few months later I might tweak it and change it a little bit. Oftentimes with certain foot conditions, people might pronate or kind of walk in on their arches a little bit. So something as simple as providing a custom arch support that fits you exactly is often really helpful. And that's one thing you don't realize when you get the over-the-counter arch supports. Sometimes they're very expensive now, even up to $70, but they fit only a generic arch, not your particular arch. And so with the FootMax system, we get your arch correct, and then sometimes we can tweak it with a lot of different pads and sometimes stabilizers around different joints that are arthritic. So there's a lot you can do with the FootMax system, but this is kind of showing and the next picture is showing some of these orthotics which slip right into your shoe and are often accommodative to certain types of arthritis, or they're corrective and trying to hold your foot in a certain position.
Yeah, I think this is a great option for a lot of different foot pains, especially if it's just arthritic pain in the foot, which can be difficult to deal with, but also, this bunion condition, plantar fasciitis. And like Dr. Van Dam said, I mean, this assessment that she does utilizing the computer system, obviously it's very accurate to know where the pathology is and what you need with regard to the creation of that orthotic. And I know she's seen it in the patients that I've sent to her for that. I mean, it's really successful. I'm amazed at how successful the orthotics can be at helping alleviate a lot of pain for patients.
Yeah, and one thing about orthotics, and I've worn them myself for like 30 years. In medical school, I got plantar fasciitis actually, and I was walking all day in the hospital, and then I would run or walk for for exercise, and so I pronate. My feet, my arches kind of turn in a little bit, and then I realized once I started wearing orthotics consistently that my knee pain got better because it helps the alignment of the other joints that are higher up in that chain. And so really from then on, I wore my orthotics as much for my knee pain as I did for the foot pain. And so I've been wearing them myself for 30 years. And I actually wear the FootMax orthotics because it's one of the ones I felt was the most accurate in analyzing my arch. So that's kind of how I got into really looking at using this particular system. So
yeah, and you make a great point on that, just because, obviously any malalignment in one joint is going to transition to the other. And so foot pain and deformity there can put stress and strain on your knees or your hips or your back. And so it's kind of everything downstream from that can affect it. But it's not, the orthotics, like you mentioned, is not just for people who have pain. It can be for, athletes, kids in high school who are playing specific sports to help prevent injury as well. So that's just another benefit of the orthotics too, is injury prevention as much as it is injury treatment, right?
Yeah, and I have seen quite a few soccer players to that regard, because sometimes you'll pay $200 and $300 for a soccer cleat and there's no arch support at all in it, and someone's running, maybe 5 or 10 miles on the field with really no arch support. So it is really, a prevention of a lot of issues when you use it in that way.
Absolutely. Yeah. So that's a great point, because obviously these kids, they're out there spending a lot of time running and pounding on their joints and feet. And so, if you wanted to come in and let Dr. Van Dam take a look at that, create some orthotics for your children to help prevent injury, I think that's a great idea. And it can definitely make a huge difference. So great thing to be able to offer. All right, so we'll move on to our next topic, which is another common problem that we'll see a lot, and that's what's called a neuroma. Or Morton's neuroma is another name for it. So basically what a neuroma is, if we look in this picture, it's basically a scar nodule that forms on the nerve. And so it usually can be due to injury at some point, or it can just be for no reason at all. But you get this, you can see in this picture in between the third and the fourth toe, there's this big nodule that is formed on these nerves that are coming out into the toes. And that's extremely painful. You can imagine you've got those nerves, which are already sensitive, and then this nodule. And when you put weight on that, those nerves are getting squeezed, the nodule's getting squeezed, and it's just pretty painful condition. Usually the symptom's pain, but it can be numbness in the toes or something like that as well. So another pretty common condition, I think, and you can get it in between any toe. I would say the second, third and fourth, maybe fourth and fifth are the most common. And the one shown here in the pictures between the third and fourth, probably one of the more common areas to get it. Typically, what would you recommend for neuromas, Jackie?
Yeah, so the neuromas, I often ask people if we can figure out what might have, precipitated the change, either in shoe wear or something like that might have aggravated it, or if somebody is training for something. So we really do take a step back and look at the shoe wear and decide, is there something we can offload that, either by putting a pad prior to the neuroma to kind of offload that area that's getting compressed, or even as simple as changing the shoe wear so the toe box or the front of the shoe is a little bit more, wide or tall, so that it can accommodate the toes a little bit better. Things like that. And then, of course, injection sometimes is really helpful, don't you find?
Oh, absolutely. Yeah. So I think, injection, the purpose of the injection is, that we have that scar nodule. And so the cortisone medicine, real powerful anti-inflammatory. So what it's trying to do is shrink that nodule down. And sometimes, I've seen one injection kind of does the trick. Usually it may take more than one, but sometimes if with repetitive injections, you can shrink that scar nodule down on the nerve, and you can get it to go away, and obviously get the pain to go away. Rarely, if it continues to be an issue, the injections haven't helped. You can do surgical treatment for that. Unfortunately, you have to take the scar nodule out, which involves the nerves, and so typically that will leave you with some numbness in the toes. But the trade-off is that the pain is gone. And so it is usually pretty successful surgery, but we usually try all the different things in order to get that to go away without having to go to surgery. But another pretty common problem that we see. And then one more problem that we see a lot, and it can be in anybody. It can be, in people of any age, athletic people, obviously we see it a lot. And then just routine activity, people may develop it, and that would be a stress fracture in the foot. So a pretty common problem. I've had one myself at one point in the past. And typically, it's going to present as just pain in the foot. And early on, if you came in, say the pain had been going on for about 2 weeks, you come in, you get an x-ray, you may not really see anything. And it may take more evaluation, like an MRI or something like that, to know for sure. Sometimes if I suspect we have somebody with a stress fracture. We may treat them like there is one, and then we have them come back, a few weeks later, and then we'll x-ray it. And a lot of times what you'll end up seeing on that x-ray, like you can see in this picture here with the arrow, you'll see that healing bone around the metatarsal. And that just kind of lets you know, okay, yep, sure was a stress fracture and it is healing. But, the last thing you'd want to do is just continue to be super active on it, and you want to try to rest that if that's what we're suspecting. What do you typically do with stress fractures or somebody you suspect?
Yeah, so I think one thing to think about with the stress fractures is really trying to think, okay, if I'm considering I may have one, it's usually precipitated by a change in either the volume of your athletic activity or the intensity of the activity. So if you're somebody that started running for a marathon, or even if you had been a couch potato the last few years and you're starting to go to the gym and run on the treadmill, things like this, that change in activity kind of overloading that bone stress can cause it. Or unfortunately, if you're a little bit older and your bone density is not what it should be, then you can get a stress fracture even without sometimes extra activity.
Correct.
So those are kind of things to think about. And of course, we don't want this to progress to a real fracture through the bone, the entire length of the bone or the width of it. So really, activity modification, unfortunately, is the first rule that we need to follow. But a lot of my patients that have had these, unfortunately, have just started becoming athletic, or they're really in a training program. So it's nice if you have the ability to consider getting in the water, right?
Right.
To keep training.
Yeah, absolutely. Pretty much for any joint problem, water therapy, I'm a huge believer in. I know Dr. Van Dam likes it as well. And it just relieves that stress off the joints, the foot. And so it allows you to continue to be active, but take that stress off. And I know when I was training for the Boston Marathon, and that's when I developed my stress fracture. I got in the pool and I pretended like I was running every day, and so at least allowed me to do some activity, but take the stress off to allow that to heal. So, but yeah, you don't, like she said, you don't want to continue to go on it and then risk it fracturing all the way through. And the problem with that is a lot of times is once you get that fracture, it changes the alignment of that bone, which then puts abnormal stresses, and so that can lead to further problems if you were to allow that to happen. So those are kind of a few conditions. Like I said, there's way more things that could be affecting you. Obviously, if you're having foot pain, and some of these things sound like something you may be suffering from, give us a call, come in, we'll be happy to evaluate you. We're going to just answer a few comments that people have said on Facebook. And so we had a message from Bonnie Evans. This is not necessarily about the foot, but she was talking about her knees, and she feels like she's got a lot of pain, and it feels like bone on bone, and should she have it looked at? I think clearly if you're feeling a sensation of bone rubbing on bone in the knee, that's probably either a fact or a sign that there is pretty significant arthritis and it's getting to be bone on bone, or it could be something like a cartilage tear, a meniscus tear, or something like that that could be grinding in there. But any of those conditions can lead to pretty significant problems, and so you probably should have that evaluated. And so we'd be happy to check that out for you. If you want to come in and have an appointment with either myself or Dr. Van Dam or anybody else, we'd be happy to look at that for you. And then just one other message from Michael Cook. Michael stated that he had some problems in his feet. Michael, I hate that you got the information that you got, but we do all treat pretty much, not every doctor in our group treats foot problems. I do. Dr. Van Dam does, obviously, and we'd be happy to take a look at that problem and evaluate it. There's a lot of things, like we said, that can be done non-surgically, but surgical treatment if needed. But we do at Palmetto Bone and Joint specialize in pretty much all areas of the body, including feet. And so if there's any foot problems, toe problems, or things like that you'd like us to take a look at, we'd be happy to take care of those for you. But that's pretty much what we have for today. I think we covered some good information. Hopefully it was helpful for a lot of people. And stay tuned. Hopefully in another couple of weeks, we'll have our next installment of our podcast, and hopefully have another great topic for everybody.
Yeah, and if anyone has any requests on topics you want us to discuss, you can always just leave us in the comment section something you want us to discuss further, either about feet or something else, and we'd be happy to include that the next time.
Absolutely, yeah. If you want to leave a comment in the comment section of this podcast. We'll look at that. We can, develop some topics based off of any requests that you might have. So yeah, if you've got some information you want to learn more about, we'll be happy to do a podcast on that. You can also send a message through our website to us, and we can look at that too. So just a couple messages, Susan, Amos. Thanks for watching, and we're glad you enjoyed the information. Craig White, hey, appreciate your comment. That's really nice of you to say. We're happy to take care of everybody we can here. We just want to do the best job for everybody we can, provide the best care. I feel like we do that with everything that we do. If there's anything we can do for you to help you feel better, get back to being active in life, just give us a call, come in, and we'll be happy to take care of that for you. All right.
Good.
Thanks, Jackie.
All right, see you next time.
All right. Take care, everybody. Bye-bye.